2, 3, 4. Wow, this is so exciting. Wow, it's so exciting. Wow, it's so exciting.
Welcome to the Polar Bear Project, a podcast for the autism community. My name's Alan Doyle, and today we're meeting with Dr. Emma O'Brien. Emma is a Chartered Clinical Psychologist providing psychological screening, assessment and interventions to young people and their families. Emma is a graduate member of the Psychological Society of Ireland. Currently, she works in an early intervention and school-age teams within the State Agency for Children with Disabilities, such as intellectual disability, autism spectrum disorder and complex needs. In private practice, Emma provides screening, assessments and interventions for a wide range of difficulties, including autism, ID, learning difficulties and emotional and behavioural difficulties. Emma has over 10 years' experience working with children with ASD and their families. In today's conversation, we discuss the autism diagnosis journey, primarily the diagnosis of young children, assessments, accessing supports, and while everyone's journey is unique, we discuss some things that you can prepare for and expect. We hope you enjoy the conversation and take something of value from it. And if so, please like and subscribe to the podcast on whatever format you listen to your podcasts on. If you're watching on YouTube, please subscribe and click the bell for notifications of new episodes. Emma, you're very welcome. Great to see you. How are you?
Thanks for having me, Alan.
We really appreciate you coming on today.
I'm delighted to be part of it.
Great. Well, listen, I'm just going to ask you straight off, Emma, why autism? What led you to dedicating such a significant part of your life's work to autism?
So autism goes way back for me, and no surprise with you, Alan, it goes way back to stepping stones, which is nothing new to you. Mm-hmm. When I finished my degree in Maynooth, I knew at that stage I definitely wanted to do clinical psychology and just didn't know what to do. Okay. And I spoke to Yvonne Barnes-Holmes there, and she said, look, Emma, you're good at looking at behaviour, that's what you're interested in. Get a bit of experience in a school for kids with autism. So lo and behold, I ended up in Stepping Stones. And to be honest, even though we would have looked at ASD during our degree, we didn't really get into the nitty gritty of it. Mm-hmm. And then it's when I started working in Stepping Stones, I really got my feet into it. And I remember my eyes were just being opened. Like, it was just incredible, first of all, to see the work that the people were doing, but also working with families and the kids that were there. And they were all so incredibly different. They all had their own little strengths. They had their needs as well. There was a reason why they were in that school. Yeah. But I remember for me, one of the big things was the trust that the family placed in us as tutors to work with their kids, and there definitely was that sense of pride when they'd achieved something that we've been working on for so long. And then at the same time being there with parents through the lows as well, when things didn't necessarily go to plan. And I always seemed to veer back towards working with kids with ASD. It was just crazy. Like, when I left Steppins, I always wanted to do my master's, and I found myself still tutoring, still doing July provision. And as soon as I finished my doctorate, my first job was in a child disability service working with kids with ASD. It's just where I've always found myself, what I'm drawn to.
Okay, very good. And actually, for listeners, because we haven't touched on this in previous episodes, Stepping Stone School is a school that I was involved in. My son attended way back, and it's for children with ASD, and it's located quite near Maynooth University actually as well. So we had lots of great undergrads and come in, and it was just it was a hive of activity and learning, and the kids were just central to all of that. They were, it was great. It was great. So I suppose moving on, Emma, anyway, and and I suppose we're here today. We're going to talk about I suppose give us an overview in terms of a family that is looking at or has been referred to you in terms of a potential diagnosis or a possible diagnosis, or in terms of a developmental delay, whether or not autism has been mentioned at that stage or not. And I suppose if you just want to give us initially anyway, a brief overview of for example, referrals, how they come your way and all that sort of stuff.
Yeah. So normally parents kind of would have some concerns maybe that they might have had about their child. And it can be about lots of different things. It doesn't necessarily mean their child will have ASD, but some of the things that they would worry about might be the child's social skills, so Maybe they're worried they're not always responding when they're called. Maybe their eye contact isn't great. Might be having a bit of trouble making friends. And they might be seeing unusual behaviors, maybe things like moving their hands in a strange way or walking on their tiptoes, or they might have some really intense interests where they know everything about a particular subject. For younger children, often parents come to me and they feel like maybe their child is maybe delayed in their milestones. They're not just hitting targets that they'd expect. Whereas with older kids, it tends to be more kind of around social difficulties, emotion regulation. And I suppose I would always say to parents, if you have any concerns, there's no harm in getting it looked at. And it's very easy to get your child assessed. So you can go to your GP, you can look for referrals to the public service if that's what you want to do. So for younger children under 5, that would be the early intervention team. If they're over 6 to 18, they go to the school age team. And now at the moment in some areas, those two services, they're amalgamating. So it's 0 to 18, which is great. And privately, it's just a case of finding someone that has the right qualifications that could look at your child. So normally someone like a psychologist, so a clinical psychologist, an educational psychologist, sometimes a psychiatrist, and it's just broaching it with them and saying, look, these are my concerns. And they're always generally very open to discussing your concerns to see if an ASD assessment is actually what you need at all in the first place.
Right, okay. And it is, look, needless to say, it's an incredibly worrying time for the parents, depending on whether it's their first child or second child. For example, if it's their first child, they may not have recognized the developmental milestone, say in their previous child, and notice that there's a difference. And it's incredibly difficult because there's I suppose it's just knowing whether or not to say something. I suppose from my own experience as well. I guess in a sense that we were lucky because Killian has an older brother that's only 18 months older than him, kind of Irish twins, and we were able to spot that he wasn't responding to his name in the same way, he wasn't paying attention in the same way, and that kind of stuff, and that's what really led to, I suppose, taking the next steps to see, well, this isn't kind of going according to plan, as it were. And so when at what point then? So is it literally just someone might pick up the phone or contact you on the website, or what way exactly do you get referrals from the GP, or what way does it work?
Yeah, absolutely. It can go any way, to be honest, Alan. So I can often do get referrals directly from GPs. Some people pop me an email, or I'll do a phone call. Usually I'd say to parents, if you're going down the route of assessment and you're going privately, look for phone consultation. Talk it through with whoever it is you want to deal with, to see what you want to look at. But it's a very easy process. Okay.
And then, so at that point, then, is it a multidisciplinary assessment, or what way does it work?
Yeah, so it depends. So sometimes parents might come to me with concerns and they're just not too sure if it's ASD or not. They don't know what they want to look at. So sometimes we might start with a screening assessment, which is kind of more looking in a broader sense at lots of different things, because obviously with ASD there's overlap across huge areas, so it could be developmental delay, it could be speech and language difficulty. So you can go for a screening assessment first. So usually a screening assessment would generally be with kind of one discipline, so maybe psychologist. Sometimes you might also have another discipline like occupational therapy or speech and language therapy. When it comes to doing the psychology assessment itself, multidisciplinary assessment is what's recommended. That would be the NICE guidelines. So you would have generally a lead clinician, who's normally the psychologist, and then you'll have an occupational therapist or speech and language therapist, or someone else maybe involved with the child already that would feed into that assessment process. And it's really important because it gives such a different perspective from different disciplines. Obviously, I go with my psychology hat on, but a speech and language therapist will really look at, what they're seeing with the child's speech and language development. The things that I'm wondering, maybe are they a little bit unusual, more like ASD? They might say, well, actually, no, Emma, hold on, that seems typical to me for their age, or that seems more like a speech delay. So it's really important to get a good sense of what you're seeing in the child.
Yeah. Okay. Very good. Very good. Things as well, like as part of that questionnaire, do you go into kind of family background and all that kind of stuff in terms of genetics and other issues and things like that? Is that part of that?
Exactly. So at the very beginning, you'll always have your clinical intake, and that's your first opportunity to get to meet the psychologist that's doing the assessment. And they will talk to you about your concerns, but they will get that background information on as well. So
Okay.
kind of even your child's medical history, going back to the pregnancy, the birth, the whole lot. Your
Right.
memory will definitely be tested on that. And then there is a more formalized assessment of developmental history as well with the AGIR later on in the process.
Okay. Okay. And so, in terms of then the actual ASD assessment, what does that entail?
Yeah, so it's a very detailed assessment. There's lots of parts to it.
Hmm.
And so there's obviously the clinical intake interview, which I said a minute ago. That's the first part. A child would typically come for a cognitive assessment as well if they don't already have one or have a recent one. And that's a really good chance for clinicians to set eyes on the child, but also to kind of look at things, well, is there a developmental delay that might be contributing to some of the things that we're seeing here? So it gives you a sense of where the child is. So when we're looking at cognitive ability, we're looking at their intelligence level and their learning, if it's where we
Okay.
expect it to be.
Hmm.
It's also really important to link in with other people that are involved in the child's care as well. So it's not all just with parents. So if the child's in a creche or a preschool, you'll link in with them as well, and equally teachers in a school. Sometimes you might go out and do an observation of the child in another environment outside the clinic as well. We always look at adaptive behaviour as well. And the reason for that is if we are to identify the child has a difficulty, we need to get a sense of, well, what is the impact of that difficulty on their daily living skills and their ability to live independently, because that's what kind of targets our recommendations and things like that as well.
Okay.
Um,
Can you just give me an example? Is that in terms of communication, or is it in terms of motor skills, or is it all of any and all? Yeah. What? Just give us a.
So all
Okay.
those skills that you need for daily living. So it could be around your dressing, it could be around conversational skills. For older kids, come down to things like being able to go into a shop and buy a few bits and pay and come back out again. So it's kind
Yeah.
of all those things that we need in day-to-day living.
Okay, okay. And one of the things, like again, I suppose from my own experience, it was that Killian was so young, so and there was a reluctance on the part of the clinicians at that time, to kind of give us a diagnosis because, well, and you're talking back in 2002, and at that stage, it's kind of like, oh well, it could be just a little delay, it could be a developmental delay, and so on and so forth, and it's only as things as development grows and then the gap becomes a little bit wider. So I suppose for the younger kids as well, in terms of what's developmentally appropriate or where there's shown signs, is there specific ways of I suppose identifying that?
Yeah, so one piece would be in the cognitive assessment that you would do, it would be developmental cognitive assessment. So you get a sense if they're where you would expect them to be.
Okay.
The other piece, I suppose, that's really helpful is that generally, now not always, but generally, children wouldn't be diagnosed until they're at least 2. Some are
Okay.
diagnosed slightly younger. But the reason for that is that when a child is 2, a lot of them are getting ready to start preschool or they've been in a creche. So you can
Okay.
get a sense of how they are against other kids of the same age in an
Okay.
environment away from mommy and daddy or their carers.
Okay, okay, okay. Very good, very good. Sorry, I kind of jumped back a little bit to go forward there. And actually, I suppose if you're unsure that your child needs a full ASD diagnostic assessment, what can you do? Where do you go?
So if it's a younger child, I'd say chat to your public health nurse first. They'd be very familiar with your child from when they're young, see what they think. Or chat to your GP. They'd be your first go-tos. The other thing is that, like I said, you can go for a screener. You can just go for an assessment of your child's overall development and see if there's anything that's flagged then at that stage. sometimes I'd say to parents as well that they find it hard maybe to explain what it is that they're wondering about or to put their finger on it.
Mm-hmm.
And I know lots of clinicians are open to parents bringing in videos to them and saying, look, this is what I'm seeing and this is what I'm worried about. What do you make of that? Do you know?
Brilliant.
So
Yeah.
you don't have to be able to put it into really good words or be able to
Yes, yeah.
explain it really well. You can use videos. There's lots of ways that you can explain it to them.
Right. Okay. Okay. That's a great idea. Yeah. Absolutely. And then I suppose preparing for an ASD assessment, and as well, Emma. I mean, we're at this stage, like that's all been very kind of matter of fact, and it's all very but on the level of worry from the parents' perspective, the kind of wanting to know and needing to know and not wanting to know, and trying to cope and manage with all of those things. From your experience, what I mean, obviously, it's such a delicate issue. What sort of skills do you try to, or what do you try to strengthen with the parents in terms of as you're dealing with this? Maybe you just might talk a little bit about that.
Yeah. So
Yeah.
a huge part of it is building a relationship with the clinicians that you work with, because a lot of parents, even though they may come as a couple or they may come individually, in a way they're coming at it alone, because a lot of parents, they don't want to talk to the people about it. They don't want to talk to their friends, their family, and they're holding that by themselves. And often parents have been worried for a very long time. And I think for parents, it's one thing to go to a professional and say, I have concerns, but it's a whole other ball game for that clinician to say back to you, yes, I have concerns too, because that makes it so much more real. And, I would find for parents that obviously in terms of assessment, you're always trying to do that to find out how best to support a child, right? And that's fantastic. But obviously that involves looking at the things that are challenging for that child, or hard for that child. And sometimes they can feel like you're being really negative about your child, or you're only talking about the bad person as well. And there's kind of two things I always say to parents is don't be afraid to highlight their strengths if you do think we're only looking at the negatives, but also try to remember that you're not doing it to be negative about them. You just have their best interest at heart and you want the support for them. If parents can at all, I say to them, find your one good person that you can confide in, or that one person that you can have a cup of tea or a cup of coffee with. Not necessarily that you have to talk about the nitty gritty of what's going on, but that just they can be there with you, because it is a very stressful experience for parents, and the waiting to find out and to know if the child does or doesn't have a diagnosis. It's very, very tough on parents.
No, it is indeed, and it's that it's so overwhelming, and it's one thing kind of being prepared to be a parent and all that, that life like that comes with that, and then for this to be sort of an additional concern, and whether or not you can cope or you're able, and what, some days you can and some days you can't, and I think it's important to even just know that, and kind of give yourself that space when you need it, for sure. I suppose then, just in terms of getting back then to in terms of then trying to, so you've got, let's say you've got your assessments, you've got the feedback, you have maybe you have some definite diagnosis, or maybe it's some of the things are, well, let's wait and see in terms of development, and all of those pieces. So then trying to, and it's what we see, all day, every day on all social media, of just trying to access supports and the right kinds of supports, Again, just if you want to just give us some information about that.
Yeah, I definitely say don't go at it alone, because it can feel very lonely, especially when you're in that situation, Alan, where you're trying to fight nearly to get services for your child, where you have a piece of paper saying my child needs X, Y, Z, and you can't get it for them, so don't go at it alone. And one of the big things now, which is obviously fantastic with social media, is it's great finding a local group of similar parents with similar children, that you can share that experience with, and often you'll get tips and guidance from them about services they've found, how, ways to get in, or even private therapists and things like that to kind of get recommendations and things like that. Sometimes for some parents, though, unfortunately, going private, it isn't possible. Like it's very, very costly. So I suppose practically you can do something like use your domiciliary care allowance for it. But I'd say to parents, don't be afraid to approach your preschools. Don't be afraid to approach your schools. They often have staff members who are very, very skilled in a lot of techniques and things like that to support children who have a diagnosis. So that's another way to kind of get into it as well. But I'd always say as well, even if you've got a private diagnosis, always link in with the public service as well, because I know their wait lists are long, unfortunately, but you will get offered something when it comes up, and that might be just at the right time where you need something for your child.
Yeah, no, very good, and absolutely true. You're right. Get on the list. That's the most important thing. Yeah, exactly. In terms of then, so what do you do, say, for example, if you continue to have concerns about your child and maybe they don't fully meet the criteria for a diagnosis and they're kind of in between, as it were? So clearly the developmental there are delays, and I know at the moment, by the way, and I know you touched on it earlier, and we'll get to that. There's a big paradigm shift in terms of strength-based approaches, but I suppose, and unfortunately, like anything, it's where you see problems occurring is how you identify where the needs are. So, of course, we're fully aware that we're just focusing on at the moment where the needs are, rather than just kind of going on and on about certain deficits or certain things like that. And maybe we can touch on that a little bit later. But I suppose there, so going back to my question in terms of when if you don't actually have a diagnosis and yet you're kind of going, well, hang on, this, my child is not keeping up with, or is not interacting with, as much as their peers. What advice, or what advice would you give parents in those situations?
Yeah. So assuming they've already discussed it with their clinician, Al, I'm going to go kind of down the day-to-day way about doing it. So it would be, I suppose, important to remember that just because a child doesn't have a diagnosis doesn't mean that they can't access services, okay? So they may not be able to get into disability services without the diagnosis, but you can access support around social skills and emotion regulation and behaviour through the likes of primary care services, and likewise privately as well. You can also do that. There's lots of kind of social skills groups that are run in local communities now as well. And again, a child doesn't have to have a diagnosis. So that's kind of another way to get support. And so it's not always based on diagnosis. And I'm hoping it's going to continue to move that way. It's more based now on a needs basis. So even some children, say in school, previously to get access to maybe resource or extra teaching, you would have had to have a diagnosis. Whereas now it's based on the child's specific needs.
That's good.
Yeah. So we are trying to kind of move more towards that. But I do think, if parents are still concerned, that can happen sometimes, particularly a young child. Maybe when they're a little bit younger, they're just not showing enough of the symptoms of autism to be given a diagnosis. So I'd always say to parents, that's okay. So just keep track of the things that they're seeing, that they're still worried about. Videos, like I said earlier on, they're great. Video what it is that you're seeing, and come back to the clinician and ask them about it. Normally about 6 months to a year later, just to kind of see how they're getting on at that stage.
Okay, very good. Another thing, actually, as you were talking there as well, is that it's kind of I'm remembering different things over the time, and I suppose one of the things as well is the shift in expectations at different stages and at different milestones for the parents, for example, and how I suppose in terms of your experience of that with parents, and I suppose from my point of view as well, I would say, and maybe you can come in as well on this, but I would say that at different points, things, can seem like this is the big problem, or this is a big issue, or this is a big fear or concern or worry or whatever that may be. And then as time goes on, they change, and sometimes some things improve and then some things don't, and but it's just those kind of horizons as life goes on, and expectations. It very much is a journey. And I suppose what in terms of that, what advice in terms of for parents again that are maybe, kind of, I suppose, zeroing in on focusing on really tiny little things that in general, in the bigger picture, when I think back, oh God, I was worried about that thing, and really it's not that big of an issue. I'm sorry, I'll think of something specific in a minute to try to help that, but go ahead anyway. Sorry.
I think I get what you're saying, Alan.
Yeah.
And it certainly is that kind of like peaks and troughs,
Yes,
how the development goes, and I think it's really important for parents to kind of take a step back sometimes. I think sometimes, from my experience, what happens maybe is there's often been a situation where the parent sees their child with another child the same age, whether that's a cousin or a similar age friend or whatever it is.
Yeah.
And they tend to see, well, that child is doing that and my child isn't. And they really want to work on that one thing and fix it.
Yeah.
And while you want to give your child support, don't just focus in on the one thing, because what happens is, it's like anything. If you focus on one thing, you're going in with blinkers and you can't see anything else. And actually what happens is you just get focused on that thing that your child can't do, rather than seeing, well, all these other things in the background that they are learning to do now.
Exactly.
You can easily get blinkers.
Yeah, no, absolutely. And I suppose, and I'll use some random, like, say, for example, if, the sport of hurling, for example, and if I love the sport of hurling and I want my son to practice hurling, and he's just got no interest in it at that moment in time, and yet it's kind of like, it's that was the thing, and I suppose, and I mean, I'm not. I love hurling, but I'm not, that wasn't a thing for me. But there's lots of those, exactly. And I suppose another thing as well, Emma, with the paradigm shift with neurodiversity and autism acceptance as well, is that there's this, really the new horizons out there are kind of, so what, so what, the child has different interests, and the child has a different pace and a different, and so what, I mean, it's kind of, Killian's 21, and and I get it, and it's easy for me to say that right now, but when you're worried and you're a new mum or a new dad or a new parent, it's not so easy. It's not so easy. But I suppose anyway, just as well to just mention that as well in terms of boys and girls, and I know it's another big topic, but if you want to just sort of elaborate on that a little bit as well.
Yeah. So it is a huge thing to get into, but just to touch on it, kind of make parents aware that it's something we're seeing a lot with girls, that they're not getting it diagnosed as much as boys, and now they seem to be getting picked up a little bit more. And parents always say to me, well, why is it that girls are different? And we do know that when we look at things like the diagnostic criteria from a clinical perspective, they're very much based on how a boy presents with ADHD, right?
Right, okay.
It doesn't map directly onto girls. But what the research is showing us is that girls, when they're younger, one of their strengths tends to be their imitative skills. Right. So that means they can learn to imitate others, they imitate social skills, and they don't maybe stand out as much as the boys in those early years. And then even when they're older, what tends to happen is girls might have, when you look at kind of the intense interest, Alan, girls might have intense interest, but the interest itself doesn't seem that unusual or odd. So say, for example, there's girls I work with and they might have a really intense interest in makeup, right? And you go, okay, well, what 16-year-old girl doesn't? Well, that seems typical. But when you look at the quality of it, it's all in. It's
Right.
intense. It's
Yeah.
all they want to look at all
Right.
day. They're watching YouTube videos, or else it's something very niche, like they're into makeup, but it's makeup for movies, you know,
Okay.
or it's bridal makeup or something,
Yeah.
something very
Yeah.
specific.
Yeah.
And we
Yeah.
think
Yeah.
that's what's happening. And
Right.
it's really unfortunate for the girls in a way that they've gone under the radar, because we know that an awful lot of them then present this huge anxiety because they're so busy trying to fit in and trying to mask all the time
Yeah.
and trying to imitate. And it's like anything, you can only put that on for so long.
Yeah.
And obviously, as you get older, that's a bigger challenge. You know, it's harder to kind of imitate and just fit in.
Yeah.
So with
Yeah.
girls, we're kind of, it's a whole other area to look at. And I'd say to you, don't be surprised sometimes if, you know, if your daughter is going for an ASD assessment and the psychologist might say to you, we need a little bit more time with this diagnosis.
Right.
It's not a bad reflection or anything like that. I think sometimes parents might panic when they hear that, you know, God, there must be something really badly wrong if they
Right.
need more time.
Yeah.
But often it's just trying to tease it out and
Yeah.
to see what's going on.
Yeah, and that, gosh, you know, and yeah, I read about it quite a bit, and whether, you know, it's a bias from you know, years gone by or whatever in terms of that focus on it, you know, but yeah, no, it really is. And you know, again, we're kind of moving up here in chronological order as we're talking, but the teenage years, Emma, they can be they can be so difficult, and it's certainly and I mean, most importantly for the autistic person themselves, in terms of what's happening to them, what's happening to their body, the intensity, the I mean, you know, the level of energy and all of those things, and trying to figure it all out. Again, what advice or what would you say there in terms of your experience on that one?
Yeah, it's overwhelming for the kids and for their parents, you know. And I'd say to parents, first of all, put yourself in the shoes of your child, right? And really within the frame of mind of what it's like for them with their diagnosis. So when you think about it, when your child hits adolescence and hits puberty, there's so much that happens to their body that is out of their control and they can't stop, whether it's hormones or changes to their body or even the way that they feel emotionally, you know, it gets so much more intense. And we know that children with autism, change is hard, you know, and change in routine is really hard to cope with, and that's anxiety provoking. And also, I suppose, you know, it's maybe more difficult for them to understand certain things, like the changes in their emotions and trying to regulate that, because they can interpret emotions a little bit differently. And we know they need support around that. But when you hit puberty and hormones come in there's no time to process those emotions, whether you have a diagnosis or not, you know, that's when things get really, really intense.
Yeah.
So I always kind of say to parents, the first thing is put yourself in their shoes and think what it's like for them. The other thing is to kind of start to prepare them for those changes. And I think that can be a bit of a taboo subject. You know, I don't really want to talk to them about the birds and bees and what's going to happen to their body.
Yeah.
And that's really, really tough for parents. But I think preparing them early on, you know, at an age appropriate level, letting them know their body's going to change, or commenting, you know, and you know your older cousin, he sounds a bit different now, doesn't he? His voice sounds different. So you're just letting them know that this is going to happen to all of us, because I think we forget that sometimes maybe a typically developing child may just look around and learn that, you know, I see my cousins, I see my friends getting older, and this is what has happened to them. This is the changes that they see. But a child with a diagnosis may not look at other people in that way and apply that to themselves, you know, that happens to you, so it might happen to me too.
Yeah, exactly. And of course, and the interest as well, you know, in terms of whether it's cuddly toys or whatever, you know, that's not necessarily going to change either, you know. So it's not like at some point, you know, someone might decide, well, I'm not interested in playing with those toys anymore. I'm moving on to other things. Whereas, you know, for example, Killian will never give up his cuddly toys, you know, and you know, so like and yet, so it's understandable for parents to kind of think, oh, you know, he's just, you know, a big kid and that kind of thing, you know, and yet, well, whatever about that opinion, the fact of the matter is that biologically he's growing into a young man or a young woman, or whatever, and that's exactly the point, so it's very, very true in terms of, I suppose, going back, but in terms of, say, the slightly wider family and friends, what advice in terms of trying to support parents and the family directly, and again, I guess going back to the assessment process, what advice would you give, say, for wider family members, brothers and sisters of who's their brother and sister, they're getting their child assessed, or their son and daughter are getting their grandchild assessed, and so on. What advice would you give to them?
Yeah. The first thing, it sounds ridiculously simple, Alan, and I know people think, what's that about? But just being there is one of the biggest things. Letting them know that you're there without putting pressure on them is a huge thing. Just know someone that, if you have those bad days where, you're just not in a good humor, you feel like crying, you have someone that you can go to, and that's okay. The other thing, I suppose, is, I don't know, maybe it's an Irish thing. I think it happens in other cultures too, but when we hear that someone's having a bad day or something, is going wrong for them, we rush to reassure. Like, we've all been there and say, she'll be grand, don't be worried about that. They'll grow out of that, they'll be grand. And it does have good intentions behind it, absolutely. But, I don't know what your experience is on it, Alan, from when Killian was going through the process, but a lot of parents would say to me in that moment, it's like, but you're not hearing me. This is a real problem for us, and it's not just going to be grand, and it is crap right now, and that's just the way it is. So I think sometimes just not trying to kind of brush it away and reassure, and just listen to what they're saying. You don't necessarily have to agree, but
no, excellent. I can still remember it. I still remember pacing up and down, and just exactly trying to communicate that look, this is actually real, this is happening, and this is where we're at, and it can be very, very, very difficult. You're right, and really, at the end of the day, I completely agree with you. There's not an awful lot that can be said, but certainly being there and saying, well, we're all in this together, and that's really important. Very, very, very true, and very, very, very good. So, preparing for school, at what point, for example, do you, again, the parent is thinking, and again, it's based on the feedback that they're getting, maybe from their clinicians or the multidisciplinary team, as to whether or not a special school should be the choice, or whether or not mainstream school with additional supports should be the choice, and again, as a parent, I will say this, and that sometimes it's important, to not to get in the way of those decisions. So there's kind of what your heart wants, there's what your head wants, but ultimately it's what, and certainly at that school going age, it's what's best for your child. And I know it sounds obvious and it sounds very, but it's not so easy. It really isn't. And because ultimately you don't want to set your child up for failure. At the same time, you don't kind of want to over-coddle them either. That's kind of in the zeitgeist at the moment in terms of, other generations and all that. So, anyway, God, my daughter is going to kill me anyway for such a boomer statement, but anyway but look, no, seriously, it's trying to find that balance or get the mix right, and ultimately, so again, what are, in terms of a decision tree or a framework for making those kinds of decisions, what do you recommend there?
Yeah, so I'd always say take a collaborative approach to it with you and the clinician. So it's not your opinion or the clinician's opinion. It's the two together, and like you said, Alan, it's trying to identify what the child's needs are and look about the different scenarios. How are those needs going to be met in each environment, and maybe how are they going to fall short of that, and what are the implications of that for your child? And I suppose it is really hard for parents. Generally parents do have an idea when their child is born even that they're going to go to a mainstream school. So throwing a special school or an ASD class into the mix, it's a whole other ball game, and it changes things. And I suppose while it can be a shock at the time, it is important to make the right decision to get your child in for early intervention, because we know that's key. But at the same time, I suppose it's remembering that even though it can seem like such a finite and permanent decision, it doesn't have to be. You can review it in time. And if you feel, look, I think they're ready to move on to mainstream out of the ICD class, great, you can do that. It doesn't mean that this is where your child is going to be forevermore. It's just a reflection of right now where they're at. But it's very, very hard for parents, I think, when they have to look at the possibility of not going to mainstream. But I think for some parents, it's the fear of what that might look like, because ASD classes, like, it's a new thing. Like back in the days of stepping stones, Alan, you were lucky to find an ASD class. I mean, like, it was few and far between. So go out and look at the options in the schools. See for yourself. Don't just take it from the clinician. Go out and talk to the teachers, talk to the staff, see how the environment is set up. I think sometimes maybe a parent might have a notion about what that ASD class might look like, or that special school, and it's scary for them, which makes sense, because it's maybe not what their experience was. So I think just try to be open about it, be collaborative with it, and be open to possibilities. Try not to just hone in on one placement that you want for your child.
Exactly. No, you're absolutely right, and it is important again to sort of look. Sometimes there may only be a couple of options, initially, and that's never ideal. But I can't stress enough how important it is to work with everybody. Yes, you have to, as you said earlier on, sometimes you kind of have to fight, or at least be persistent to make sure that whatever's available, whatever your child's needs are, that you can get them met in some way. But I think regardless of even if it is just, well, we're starting with this placement, this is the placement that's available, and this is where, this is what's available. I think the important thing is, as you said there, is engage with the teacher, with the SNAs. There's very much, they are there because the teachers and the clinicians are all there because, like, similar to, just like you, Emma, that they've found a passion for this work, and so it's all about the engagement, and and at the end of the day, the focus is on the child at that stage, and it's all about what we can do. And as you say, that may change, and the needs may change, and other opportunities and options may open up, but at least you're kind of what you've got, you're giving it, you're giving it your all at that moment in time, and that's kind of really important, because look, in the real world, there's the ideal options, and then there are kind of other options, and then there's sometimes it's just what's available, and you really have to make the most or the best of whatever you can, and I think professionals appreciate that, because often as well, and that where I'm leading to this is that there can sometimes be conflict where, I know my child better than anyone else, and that is true, your child knows themselves even better again. And the thing is as well is that to get, as I said earlier as well, is not to get in the way of what's best, and to try and work with everyone around you. And again, if your child, the team around the child is there for the child. And if you're as a parent, whether you're not necessarily the coach, but you could very well be the coach, but the whole team around you, and it's very, very important to kind of build that kind of teamwork around it, rather than a conflict. So if you want to just discuss that, and listen, it's all easy saying that, and I kind of I've come out the far side of some of those in terms of that, because, and I'm learned, that's why I'm sharing here, is because I've learned sort of the hard way sometimes about that. But I really think it's an important one, because sometimes an awful lot of energy can be lost, and sometimes the focus goes away from the child, because of it. So if you just wanted to just sort of, I suppose, talk about that, and building that kind of, as a parent, what you can bring, and how to bring it as well,
Yeah, absolutely. And I 100% agree, Alan. I always say to parents, they are the expert on their child.
Yeah.
I might be the clinician who specializes in this area. My role is to come in and help with understanding and give some guidance, and it's trying to get that balance, because being an expert doesn't necessarily mean that you have to close your mind to other ideas and other perspectives. And that's the key part, and of course, I do think a part of that comes down to the relationship that you build with the people you're dealing with, to be able to consider other perspectives. I would say to parents, I think it always comes from good intentions, but I think sometimes, particularly when they're really worried about something, right, they can go in all guns blazing, looking for something for the child. And I understand that, they're seeing that their child is struggling with something, that they need something. But sometimes they get into that discussion when they're still very emotionally charged, and it can end up being loggerheads of, this is my opinion, but that's my opinion, and nobody gets anywhere. So I think sometimes it's helpful to write down, and it sounds silly, write down what it is that you're concerned about, that you want to talk about, or have that friend or family member that you can confide in to bounce off them, because it takes out that initial charge. And I would always say, don't be afraid to approach the staff or clinicians involved, but just think about, if somebody knocked on your door and said, now, I want this and I want that, what kind of reaction are you going to get? Even if, if you knocked on the door and said, I want €50, and they have €50 there, but if you say, I want it, you're not going to get it, and it's not a case of going begging either, but it's kind of being, look, I'm worried about this. What do you think? What can we do together right now to support my child with this? Because I think, it's a tough situation to be in, because obviously services are under resourced and there's only so much they can do. But I do think parents and the clinicians, they do have the child's best interest at heart, and they're just trying to find a way to keep things afloat and meet those needs for parents, and build that relationship with them.
No, absolutely. And I think I completely agree with you, because nearly every time I can say that if I've been involved in where there's conflict, there's incredibly intense pain going on, and that's really it. It's just whether an overwhelm where I think, just going back to something you said earlier, and I never thought of it like that before, but sometimes it's difficult, but to capture things on video and try to explain it like that, and as you said, writing it down as well, it absolutely, you're starting that process of getting it out of you and onto paper or and say, look, these are the things that I'm struggling with. But that takes a bit of courage as well from the parents. They don't want to break down in a meeting, they don't want to cry, or they don't want to, so sometimes it's kind of easier to get angry than it is to just break down and be vulnerable and say, look, I don't know what the hell to do here, or whatever, or I need this thing right now, he needs it, she needs it, we need it, that kind of thing. And it's just I think it's really, really valuable. I think it's really important, because ultimately, as I said, it is a team. It's a team around that particular child. So it's really important. But fantastic. We've talked about getting support kind of within the family network and working with professionals and clinicians and things like that. But in terms of, and I've actually in another podcast talked about my counselling journey with the counsellor here, and you actually are you specialise in acceptance and commitment therapy. If you want to talk a little bit about that and about how what the theory and the practices behind that.
Yeah, so it's a model I often use with parents and also actually teenagers when they're older as well, when they know about their diagnosis.
Okay.
And I find what happens is, particularly in the early years, the parents' focus goes all on the child and getting the child's needs met, and the parents' needs go by the wayside, And the other piece is that sometimes parents, they might get support from friends and family, but it's just not the same. It's just not enough, because they can't be your therapist. They can be your sounding board, but they can't be your therapist. So sometimes parents do find, I need my own bit of therapy to kind of come to terms with the diagnosis and the life that we have. And acceptance and commitment therapy is a really nice model because it's very much based on this idea of values-based living. So it pairs things back for parents and thinks about, okay, well, what is it that's important to you in life? And yes, you have been thrown a curveball, and there's space to explore that. And, the pain that you would have mentioned, Alan, and the overwhelm, there's space to absolutely explore that. And at the same time, then think about, okay, well, what can I do now to still live the life that I want, and to still live the life that I want with my child? And it's based on your values. So it's just a really nice way of trying to, I think, reframe it. We're getting the balance of have an opportunity to talk about your experience and the pain that goes with it, but also being able to think about the other side of that. What can come next for me, and how does my life go forward now?
Very good, very good. And mindfulness plays a role in that, doesn't it? Do you want to just talk a little bit about that?
Yeah, absolutely. And I find with parents I work with, it's a huge thing, because you probably had this experience yourself, Alan, with Killian, where you're always thinking of the next thing, so you might get school sorted and then you think, what about secondary school? And what about when he's making friends? And what about if he goes on a sleepover? It's all these things going around in your head, your mind never stops. But we can't live like that. You're not living your life if you're caught in your head. And mindfulness kind of helps you to just pause and stop in the present moment. And I think people get afraid of mindfulness. They think it's a big scary meditation. I couldn't do that. I couldn't focus for a long time. But there's so many simple ways you can integrate that into your life. It doesn't have to be sitting down to do meditation. It could be stopping for 2 seconds and thinking, right, what can I see? What can I hear? What can I taste? What can I smell? And it's incredible that just stopping for those few seconds can take you out of your mind to focus on what you're doing. And particularly I find with the families that I work with, parents spend so much time working with their kids, to support them and try to develop their skills. And then when it comes to maybe downtime, maybe chilling out at the weekend, going for a walk in the park or watching a movie, that should be a time that you get to enjoy with your child, where you're not working with them. But parents, you'll find, will keep going around about, what do I need to do next? I need to start preparing this social story. I need to start doing that. And they're not getting to enjoy those moments of just being and not having to be teacher, and just being mommy and daddy. And that's all they want to be. So mindfulness is really great for that.
Yeah, brilliant. Yeah, no, absolutely. And sometimes, to be honest, it's during those times of just play and hanging out that you really, that some of the magic moments happen. That interaction, that oh wow, that those wow moments, that they're just that's you're absolutely right. But it can be very, very difficult when you're in kind of go mode a lot of the time, very, very, very true. And I suppose as well then, just to kind of again come back to the strengths-based model that we talked about now as well, and how inclusion and integration is such an important, and acceptance really is such an important part, and there's a big paradigm shift within the autism community, and trying to I suppose influence society at large about that. I mean, again, you mentioned social stories there, and how some social stories are, they're obviously designed to be helpful, and we're going to go here, and we're going to, this is what this place looks like, and this is what's going to, what's going to happen. But then other social stories can be actually stressful, because they're trying to model a type of behavior that the child finds upsetting or aversive even, and yet it's hard to kind of understand that, because unless or to have that. So it's really, I guess, it's kind of to be in tune more with your child, and really to kind of understand the nuances and to slow right down. I think that's really, really important. I think that's an important thing there. Do you want to just talk a little bit about that?
Yeah, I think they're definitely, in the past, I think there was this kind of movement towards helping children with ASD to conform in a way, like to fit in. And we seem to have moved away from that, and it's incredible to see the difference now in terms of the perspective, and it's helping parents think about, okay, just because society says this is the norm, is that what my child needs? Is that important for them? One of the big ones that comes up is eye contact, right? Eye contact for a person with ASD, it's not a case they're choosing not to look at you, they want to avoid you. For some of them, they genuinely don't like it, or it's actually uncomfortable. We know that now from adults with ASD who talk about their experience. It is uncomfortable for some of them to be told, you have to look at me, And I think that's a hard one, because in the past it was told, well, that looks odd, or it looks strange if you don't look at somebody when you're talking to them. But now I think with more of an awareness of autism, we're kind of thinking, okay, well, my child doesn't like to make eye contact, it's not about forcing them to do that, but it's trying to find out a way that, well, how can we make sure that they still are included in society? Because if a person doesn't have ASD and they see that the person with ASD looking away, they might think, well, they don't want to talk to me. So you can think outside the box, think of other strategies. Can they just turn their body towards them? They don't have to look at them, just turn their body towards them. And I think there's more space for that now, where it's trying to work with the person with autism and with the family and what they want for them, rather than what society says we should or shouldn't be doing. What's the norm?
Yeah, absolutely. And that's, again, because the key there is engagement and the context. So if it's in the playground, for example, or if it's in the shop, or if it's in the classroom, whatever it is, there are different, I guess, expectations or different norms, whatever that is, in terms of those pieces, for sure. It reminds me, actually, I can't remember who said it, but on the whole eye contact thing, where one of the lecturers one day turned around and he says, I live in New York, nobody makes eye contact in New York. So I mean, it's a bit overrated, for sure.
Exactly. You have to find what works for you. You have to find what works for your family. It's even the language that we use now, I will sometimes say person with autism, sometimes I say an autistic person, and it's now that openness to say to them, how would you like me to refer to you? Like if I'm working with a teenager or an older person, I'll say, what do you like to refer to yourself as? Because with this kind of movement towards neurodiversity, we know that an awful lot of adults that have a diagnosis, they would say that they prefer to be referred to as autistic, because they believe that it's part of their makeup, that it's not separate to them. Whereas I see the other side of it as well with parents that come to me. For them, they kind of go with the person first kind of piece of, my child has autism. They're them first, and then the diagnosis. So there's all kind of different movements around it, and I think it's being open to different perspectives on it.
So listen, I just want to say thank you so much for joining us today. I would really love to have you back. I think there's so much more that we can kind of dig into. There's we've only touched the surface on a few topics. I'll put all your contact details in the show notes of the show, where they can reach you and so on, email and website and all that kind of stuff. Okay.
Brilliant. It's been an absolute pleasure, Alan. I'm delighted to have done it with you.
Fantastic. Okay, great stuff. Thanks for taking the time to watch. We hope you took something of value from today's show, and you will find all links and show notes on the website. As we did mention, everyone's journey is unique. However, it's also reassuring to know that you're not alone. If you have any ideas or suggestions for us for the podcast or the Polar Bear Project, please contact us. Drop us a line to hello@polarbearproject.com. You can find us on Facebook, Instagram, YouTube and Twitter, and we want to hear your story. Please get involved. The project is currently 100% voluntary, and you can donate and subscribe on the website. We're so grateful for all the support to date. And also, if you want to advertise, please get in touch with us too.
1, 2, 3, 4. Wow, this is so exciting. Wow, it's so exciting.